Let's dive right into this explainer because today we are taking a pretty wild journey. We're going to start way zoomed out at a staggering global scale, and then we're going to zoom all the way down to the microscopic level. We're unmasking a stealthy threat that is literally hiding in plain sight, a threat that affects every single organ in the human body. We are looking at the air quality crisis, and specifically, we're going to focus on the striking realities found in Malawi.
So let's start with the big picture. 8.1 million. That is the number of people who die globally every single year directly because of this invisible crisis. I mean, it's a number so massive it's honestly hard to even wrap our heads around, right? But it really sets the stage for exactly why we need to understand what's happening here.
Because what we're talking about is the silent global crisis of air pollution. And this isn't just an environmental issue, it is a profound medical emergency. Air pollution is consistently ranked in the top 2 or 3 global risk factors for early death, right up there with high blood pressure. And honestly, the most tragic part, it's responsible for over 700,000 deaths of children under 5 every single year, mostly from lower respiratory tract infections.
Now, take a look at this because it brilliantly illustrates the paradox we're dealing with. This is a gorgeous, serene landscape in Malawi. It looks pristine, doesn't it? But this view masks a hidden public health emergency. The reality is, every monitored location in Malawi currently exceeds the World Health Organization's annual guidelines. The toxic reality of the air is entirely invisible to the naked eye.
Okay, so what exactly is the threat? Let's officially define the villain of our story. PM 2.5. This stands for particulate matter that is less than 2.5 microns in diameter. We are not just talking about dust here. It's a highly toxic cocktail made up of combustion particles, organic compounds, and heavy metals. And that specific chemical makeup is exactly what makes this invisible killer so stealthy and so dangerous.
Just to put this invisible threat into perspective for a second, think about a grain of fine beach sand. That's about 90 microns. A human hair is maybe 50 to 70 microns. Things that size, they're easily filtered out by our nose hairs and our upper airways. But those tiny red dots on the scale, that is PM 2.5. It is so infinitesimally microscopic that it bypasses our body's physical defenses completely. Let's trace that terrifying journey into the human body. First, it blows right past our mucociliary defenses. The little hairs and mucus in our respiratory tract that are supposed to catch invaders. Second, because it's just so tiny, it deposits deep into the alveoli, those tiny little air sacs in our lungs. And third, and this is absolutely crucial, it translocates directly into the bloodstream. Once it's in the blood, it can travel anywhere.
Now let's zoom directly into a rural Malawian home to look at actual exposure levels. 1,338 micrograms per cubic meter. That is the shocking peak indoor PM 2.5 level recorded during evening cooking over a traditional 3-stone fire.
But wait, to really understand how staggering that 1338 microgram spike actually is, let's compare it to the medical consensus, 5 micrograms per cubic meter. That is the World Health Organization's recommended annual guideline for safe air. We are talking about indoor peaks in Malawi that are literally hundreds of times higher than the baseline for human safety.
When you ground this data in visceral human reality, the Malawian kitchen becomes quite literally the most dangerous room in the house. A cook's average personal exposure over a full 24-hour day is 706 micrograms per cubic meter. Just think about a child sitting in this smoke-filled kitchen. They are inhaling the carbon monoxide equivalent of smoking roughly 40 cigarettes a day. There's no other way to say it. That is a catastrophic level of personal exposure.
Now, the sources of this crisis actually shift depending on where you are. In urban hotspots like Blantyre and Lilongwe, ambient pollution is largely driven by fleets of diesel vehicles, many of which are over 15 years old, open municipal waste burning, and industrial emissions. Contrast that with the rural reality, where massive spikes come from post-harvest crop residue burning, charcoal production kilns, and of course that intense indoor cooking smoke we just talked about.
But here's the thing, whether you're breathing diesel exhaust or wood smoke, the biological impact is profound. The absolutely crucial takeaway is that this is a whole body disease. Air pollution affects every single organ system. We aren't just talking about asthma or COPD anymore. We're talking about heart failure, strokes, cognitive decline like Alzheimer's, adverse pregnancy outcomes including preterm birth, and even insulin resistance and subfertility.
And the equity issue here is just heartbreaking. Because who carries the greatest burden? Children under 5 are incredibly vulnerable. In fact, household air pollution drives roughly 50% of all pediatric pneumonia cases in Malawi.
Pregnant women face risks of low birth weight and stillbirth due to placental transfer of these toxic particles. The elderly suffer acute cardiac and respiratory events, and outdoor workers, like traffic police or market vendors, well, they endure sustained, high-dose exposure all day long.
And there's actually a really suspenseful time lag to this harm. When PM 2.5 levels spike, the hospital admissions for pneumonia don't just happen immediately. The risk rises sharply and then peaks 2 to 4 days after the exposure. It's like a slow-moving wave of harm. A bad burning day on a Monday means the intensive care units are going to be overwhelmed by Thursday.
Okay, let's move to our next section, solutions for clean air, shifting systems and habits.
Let's start right at home with the energy ladder. Crop residue and wood fires push exposure to well over 300 to 500 micrograms. Even if you shift to a charcoal stove, that only brings it down to 150 to 300, which, as we know, is still highly polluting. Improved biomass cook stoves simply don't get the air clean enough. The data is incredibly clear. Only a sustained shift to liquefied petroleum gas, LPG, or solar electric cooking can actually achieve the clean air targets we need to protect human health.
But let's be real. Individual households cannot do this alone. We need concrete, systemic solutions. This means government stepping in and subsidizing LPG and solar cooking to make them truly affordable. It means adopting East African low-sulfur fuel standards to clean up urban transport. In agriculture, we have to promote no-burn farming practices. In urban planning, we need strictly enforced green buffer zones around vulnerable places like schools and clinics. And finally, health systems have got to link air quality index data directly to emergency department surveillance. Which brings us to our final, overarching point. Clean air is a fundamental human right. It is not a modern luxury. We've seen the data today, from the microscopic particles sneaking into our bloodstreams to the massive systemic changes required to stop them. The science is completely undeniable, and the solutions, honestly, they are within our reach. So, what will it take to clear the skies? Think about your own role in advocating for that change. Because, at the end of the day, every breath we take absolutely matters.